Causes of bloody diarrhea and effective solutions for patients.
As a doctor, understanding the causes of bloody diarrhea is essential for diagnosing and treating patients effectively. Bloody diarrhea, also known as dysentery, is a condition where blood is present in the stool, usually indicating inflammation or damage in the intestines. It can be alarming for patients, and prompt diagnosis and treatment are critical to prevent complications.
Causes of bloody diarrhea.
1. Infections. One of the most common causes of bloody diarrhea is infection from bacteria, viruses, or parasites. Bacterial infections like Shigella, Salmonella, Campylobacter, and E. coli can cause inflammation and ulceration in the intestines, leading to blood in the stool. Parasitic infections, such as those caused by Entamoeba histolytica, can also lead to similar symptoms. 2. Inflammatory bowel disease, IBD. Conditions such as Crohn's disease and ulcerative colitis are chronic inflammatory diseases that affect the gastrointestinal tract. Inflammation leads to the formation of ulcers in the intestines, which may result in bloody diarrhea, along with abdominal pain, weight loss, and fatigue. 3. Colon polyps or cancer. In some cases, bloody diarrhea may be a sign of a more serious underlying condition, such as colon cancer or large intestinal polyps. These abnormal growths can bleed, especially when irritated by bowel movements. 4. Ischemic colitis. When blood flow to the intestines is reduced, often due to blocked arteries, it can lead to ischemic colitis. This condition causes inflammation and injury to the intestines, resulting in bloody diarrhea. 5. Medication side effects. Some medications, such as nonsteroidal anti-inflammatory drugs, NSAIDs, or blood thinners, can irritate the gastrointestinal lining or increase the risk of bleeding, leading to bloody stools. 6. Hemorrhoids and anal fissures. Though not as severe as other causes, hemorrhoids and anal fissures can also lead to blood in the stool. These conditions often cause bright red blood and are associated with straining during bowel movements.
Solutions for patients with bloody diarrhea.
1. Hydration. One of the most important steps in treating bloody diarrhea is preventing dehydration. Patients should be encouraged to drink plenty of fluids, such as water, oral rehydration solutions, or electrolyte-rich drinks. Severe dehydration may require intravenous fluids. 2. Medications. Depending on the underlying cause, medications may be prescribed. Antibiotics are used to treat bacterial infections, while antiparasitic drugs are needed for parasitic infections. For inflammatory bowel disease, doctors may prescribe anti-inflammatory medications or immunosuppressants to reduce intestinal inflammation. 3. Dietary adjustments. Patients should avoid foods that may irritate the gut, such as spicy foods, dairy products, in case of lactose intolerance, and high-fiber foods during an active episode. A bland diet, including foods like bananas, rice, applesauce, and toast, the brat diet, is often recommended until the symptoms improve. 4. Surgical intervention. In severe cases, such as when there is a risk of bowel perforation or in cases of colon cancer or large polyps, surgery may be necessary to remove the affected part of the intestine. 5. Monitoring and follow-up. Close monitoring of the patient's condition is essential. If symptoms persist or worsen, further diagnostic tests, such as colonoscopy or imaging studies, may be required to identify the exact cause. Regular follow-up appointments help ensure that the treatment is effective and complications are avoided. Conclusion. Bloody diarrhea is a serious condition that can arise from various causes, ranging from infections to chronic diseases like IBD or cancer. As doctors, it is crucial to identify the underlying cause and provide appropriate treatment. By ensuring proper hydration, administering the right medications, and making necessary lifestyle changes, we can help patients recover and prevent future episodes. Early diagnosis and treatment are key to improving outcomes and ensuring patients' well-being.
This essay provides essential vocabulary for medical students, such as dysentery, inflammation, colitis, and rehydration, which are important for understanding and communicating in medical contexts.
This content is just an example for learning English. Thank you for watching. How do you feel about this video? Please leave a comment below.